Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender adult care. Welcome to my channel. If you've not had the chance to subscribe, please make sure you do so. This way you are supporting me, your ally, and also you're helping so many other people find this content, especially during this very difficult times. If you don't yet follow me on Instagram, link is below. Also, come say hello. Join me on Instagram. I show up there to additionally share tips, guidance, advice with all of you. This is my way of connecting with all of you. So make sure you connect with me on Instagram as well. For today's video, going to share with you my number one tip for managing dysphoria when dysphoria hits hard. Now, whatever that hard may vary for all of you. For some of you, dysphoria may hit so hard that it is pretty debilitating. For some of you, it may suddenly start affecting your capacity to focus, your capacity to be productive. For everybody, is dysphoria hits differently. We already know this, right? Dysphoria tends to affect everybody very drastically differently. But I do know that when it does affect you, it can be very challenging. And I know that a lot of you already have your own ways of coping with it when it does gets very challenging. And some of you may already have this tip, maybe not. But not only do I want to share this best tips that I have, I also want to give you an understanding why utilizing this particular coping way of dealing with dysphoria is probably by far one of the best out there. So here's the thing. When dysphoria hits, and when it hits really hard, and something tends to especially trigger the dysphoria, whether it is the gender envy you experience, or maybe you're in the midst of intimacy with your partner, and that's just being vulnerable and being exposed tends to trigger dysphoria. Maybe you are at a doctor's visit and that tends to trigger dysphoria. Maybe you are just sitting and looking at yourself. Maybe it's just waking up in the morning and confronting yourself in your reality may also trigger the dysphoria. When dysphoria does gets triggered, what happens is that it's almost as if it starts to expand and take up space inside of your head space. When it starts to expand space inside of your head space, you can't help but start thinking about it. When you start thinking about it, you can't help but devote even more mental energy to thinking about dysphoria. Not to mention, then it also starts to trigger a physical response where you may actually feel a physical reaction to it. Now, I want to be very careful and not to um I'm not saying that dysphoria is a fully byproduct of a notion and ideas you entertain inside of your headspace. Dysphoria is an innate almost response, and something tends to trigger that innate response. Once it does trigger, however, it first lends itself in the headspace oftentimes. When it lends itself in a headspace, because we are creatures of thinking, we tend to start thinking about it. And the reason why you tend to think about it is because you're trying very hard with your mental faculties to ease the distress of dysphoria. Sadly, the opposite happens. The more you think about it, the more it may expand. The more you are focusing on it mentally, the more it occupies your mental faculties, more occupies your mental energies. As a result, you have less capacity to think about anything else. This is why, if you ever noticed, you may be focusing at work and feel pretty productive, and then dysphoria gets triggered, and suddenly you have a hard time focusing. The reason why you have a hard time focusing is because now majority of your head space is occupied and preoccupied thinking about dysphoria, thinking about distress. That's what distress do to us, right? It's pretty hard to ignore any distress. Again, I made this example of dysphoria equal to having a migraine. You get a migraine, it suddenly affects whatever it is you're doing in front of you. It's not just going to suddenly go away. And you're going to give attention to it. So Because dysphoria, when it gets triggered, usually first lands in a headspace. What I recommend is to try the best you can. This is my number one tip, is to get out of your head and get into your body. I know this sounds almost paradoxical because the whole distress of dysphoria stems from the incongruence one feels to one's body. So when I'm asking you to drop into your body, it's almost like I'm asking you to experience and feel more dysphoria. Not exactly. What I mean dropping into your body is to get out of your head. And to get out of your head, to get more into your physical form. It's very different than become super aware of your body and pay attention to your body parts and how you feel about them. That's, of course, is going to cause you more distress. What I'm saying is this. This is, by the way, why when people feel a lot of dysphoria, I have a lot of clients who are runners, and then they go for a physical run, they feel better. Why? Because they're no longer in their headspace. When they're no longer in their headspace, they're no longer expanding on the pain point. The pain point may still be there, but now it's not causing them as much as distress. So dropping into some kind of physical activity, doing something. I'm not talking again about dropping into your complete connection to your body, but doing something. Grounding technique and exercises help. Tactile grounding techniques where you're sitting down and you feeling your hands touching the table and what the wood feels like underneath your hands brings you out of your headspace. It interrupts that loop, that cyclical loop of thinking pattern that now you are lost within when you start to overthink and think about gender dysphoria. Grounding exercise, meditation, mindfulness, breathing exercise. I mean, if you Google grounding exercises, you're going to have a lot of different variations that Google alone is going to bring up. Another great thing to get out of your head by getting into your body by doing something is engage immediately if you can in some senseless task. Dishes, cleaning around your house, laundry, organizing, doing something mechanical, something that is just doesn't take much thinking, a chore, a task, something pretty mindless is going to again break down that loop of pain point. It's still going to be there, but it's going to help tremendously to quiet it down because now you're going to be focused on something else. This is why a lot of people, when they really focus on their work and become incredibly preoccupied at work, they notice that their dysphoria tends to disappear or tends to quite drastically. Why? Because they're occupying now majority of their headspace to thinking about their work, and there is no capacity to think or experience or feel to dysphoria. Our headspaces have a particular amount of storage, if you will. And so if you are lending most of the storage to some mindless task, doing laundry, maybe even interacting with something, then you have less of a storage occupied to sit in the strange pain of dysphoria. This is why it is so incredibly helpful. For those of you who have little kids, toddlers, I don't, I don't have kids, so I don't know what would be little, right? To me, anybody below age 8 is a little kid. Um, Start playing with them. Do something with them. Do some kind of activity with them. That's also going to distract you. Those type of distractions that are rooted in getting back into your body, getting back into the present, is going to help distract that loop. This is the best tip. Again, those of you who love to exercise, if you're feeling very distressed with dysphoria, can you drop everything and start exercising? Those of you who have chores, activities to do, focus on those chores. Even going for a walk. Listening to music that elevates your mood is also going to help. Getting up and dancing to the music is going to help tremendously. This is my number one tip. A lot of times, what people do when dysphoria strikes is they remain in their headspace because as human beings, we're so accustomed to feelings that I feel something and I'm going to solve it with my headspace. Dysphoria is not something that you can solve in your head. If it was solvable in your head, nobody would be utilizing coping mechanisms and nobody would be going through gender transition. It is one of the things that is not susceptible to being solved in a headspace. But we restore to it because we're creatures of habits. And as a result, we get lost again in these loops. And staying in that loop, what causes the pain and what makes dysphoria feel even worse. So again, my recommendation is do a mindless chore activity, drop into your physical self, exercise, mindfulness, grounding techniques, meditation. They all are going to help tremendously. Comment below, what is your tip? What do you tend to do when dysphoria hits? What do you find helpful to you? I know for a fact staying inside of your head, thinking about it is not helpful. Sometimes people do this, by the way. I forgot to mention this. A lot of you think that when dysphoria hits, what's helpful to you is actually going on, for example, social media, looking at other transgender stories, listening to other trans people, looking at transition timelines. And to some extent, logically, you would think it should be helpful, but it's actually not helpful because, again, you're retaining your capacity to remain in that loop. You're almost putting yourself in that context, putting yourself in that environment where you are allowing that loop to exist versus severing or versus makes me think of that series severs versus of disrupting that loop. And what you want to do actually, you want to disrupt it. You want to break it away. You want to get into your body in this physical way of doing some kind of physical activity, mindfulness, groundedness, because again, once you start watching that transition time source and whatnot, you're doing the opposite. You are remaining in that pain point versus getting out of that pain point. So comment below, share what you tend to do, what tend to help you. Love to hear your comments, as your comments help everybody else who reads them. And I will see you all next time. Goodbye.